what should I do about my skin? What is the problem in the summer?
There is early onset of wrinkles, fine lines, and uneven skin tone, and also the skin texture tends to kind of reduce.
Even things like aging, wrinkles, happen more because of strong sun.
Yes, definitely.
Is sunscreen the only solution?
Sunscreen is an essential, but we cannot really say sunscreen is the only thing that is going to protect you against the sun exposure, and it is only for the face.
People with white skin are more at risk of skin cancer.
Right.
People with brown skin, so people like us, are less.
Yes.
There are so many brands and so many companies which are doing this. But are there products which are more recommended? Are there brands which are more recommended? What kind of food impact do we have, or drinking impact do we have on our skin?
Smoking definitely makes our skin age much more faster.
For anti-aging efforts, to reduce their pace of aging or do anti-aging, what can they do? So the summer is coming and a lot of people are worried about how do I take care of my skin. I'm lucky today I have an expert in the studio, Dr. Nirupama, who's been practicing dermatology in South Delhi, takes care of a lot of people, their skin, hair issues, and a lot of other dermatology issues. Also works on the cosmetology space where people go for Botox and skin care and all that kind of stuff. So Dr. Nirupama, thank you so much for coming.
Thank you for having me here.
And I'm really keen to start off with this summer in North India. People are worried. What should I do about my skin? So, क्या आपका advice है? What should people do?
So actually when we transition from winters to summers, we definitely have to change a lot of things in our skincare routine. So usually in winter, since the humidity is very low and also the air is very dry, we tend to experience dryness over the face. So we use thicker creams, thicker formulations, but during summers, like we have to be using lightweight moisturizers, lightweight sunscreens, and also since the UV index is very high during summers, sunscreen is an essential thing to be included in the skincare, especially if you're too much exposed to the sun, and if the exposure time as well as the duration is more, then a sunscreen application is a must. And also one must note that we have to apply adequate amount of sunscreen to protect from sun damage.
Okay. So, as growing up, one of the things that I thought is the problem in the summer is because the sun is stronger, you get tanning and your skin sort of burns. That's the only problem. Is that true, or there are more problems? What is the problem in the summer?
So definitely, like when there's more exposure to the sun and during the peak hours, there can definitely be sunburn. But since we have more melanin, we have brown skin, so sunburn is not as common in us as compared to Caucasians or people who have less melanin. But definitely tanning can definitely occur. There can be pigmentation, there can be aggravation of pigmentation, and also excess sun exposure can sometimes also lead to PMLE, that is polymorphous light eruptions, or sometimes solar urticaria. So those are some dermatological issues that can come. So if we talk about aesthetic issues or cosmetic issues, yes, tanning is one of the most common one or more common one that most of us are worried about.
But are there more things because of that? Because of sun?
Yeah, so generally there is early onset of wrinkles, fine lines, and uneven skin tone, and also the skin texture tends to kind of reduce. And also with time, if because of the cumulative sun exposure, there can also be breakdown of more collagen, and they can be like early signs of aging. There can be loss of face volume, and of course, as I said, fine lines and wrinkles and uneven skin texture, uneven skin tone that can happen and make one look a little more older than what they usually are.
Oh, interesting. So you're saying even things like aging, wrinkles, happen more because of strong sun?
Yes, definitely.
Okay. So, and you used a few terms which I want to understand. One is melanin, one was collagen.
Yeah.
What are these two things?
So melanin is basically a pigment. So our skin is made up of multiple cells, one of them being a melanocyte that produces melanin, or the skin pigment that protects our skin. It's against the sun exposure and the damage it can cause. So that's why I said that we don't burn as much as somebody who has lesser melanin would, like a Caucasian. If we talk about collagen, collagen is basically a protein in the skin. So it makes up 70% of a skin protein and 30% of a body protein, and it is the one that kind of gives firmness to the skin, makes us look much more younger, much more youthful. So once it is damaged, of course, like your skin tone and skin texture would be more uneven, fine lines and wrinkles would kind of creep in. It'll make you look more older than what you are, and it is essential for a more youthful skin, more like plump, hydrated skin.
The more collagen you have.
Yeah.
Okay. And now the solution to all this that I constantly hear is sunscreen. Sunscreen has become a common word that I hear from a lot of people. Now, is sunscreen, two questions. Is sunscreen the only solution? And second, is sunscreen only for the face or the entire body?
Right, actually, that's a very good question. So, if you were to ask me which is one most important skincare product that one should be applying, I would definitely say sunscreen.
Okay.
And sadly, like most of us are not aware. Even I wasn't as aware until I started my dermatology residency. And
I have never used a sunscreen in my life.
Okay, okay.
No, you're really hating me for this, but that's the fact. But I will start using.
Yeah, so that really pains me because...
I'm sorry.
Yeah, so the point is sunscreen is an essential, but we cannot really say sunscreen is the only thing that is going to protect you against the sun exposure, and it is only for the face.
Okay.
So there are multiple problems I usually see with people who are even applying sunscreen.
Hanji.
One, they are not using adequate amount of sunscreen. Second, they are not reapplying it. The other thing that we tend to forget is sunscreen or no, as a matter of fact, no sunscreen gives 100% protection. So
Okay.
if you're out there in the sun, the exposure is a lot, or if you're out in the mountains at a higher altitude or probably at a beach, or there is prolonged sun exposure, if you think that you apply sunscreen once in the morning, even like adequate amount, you'll be protected. It's actually not true. So yeah, so you have to take other measures also, like probably a wide brimmed hat which has a UPF rating. So if you would know that sunscreen has an SPF rating.
Right.
So similarly, our clothes or fabric also have a UPF rating. So usually a wide brimmed hat with a UPF rating, you cannot just use any hat and be like, okay, I'm protected. So like when I go hiking at a higher altitude, of course wear a UPF rating hat. I also use a neck buff to kind of protect the neck, or probably, put it up and protect my face also. And also like glasses, the big ones, they protect the periorbital area. So all those factors, then umbrellas, and if you can be in a shade, then of course that also gives you great amount of protection. But we can't be like, we are using a sunscreen and we are sorted and it is not going to damage our skin, any kind of sun exposure. That's not true.
Oh. So it's not like you put on a sunscreen and now you can just hang on the beach or hang on the sun area and nothing will happen.
No. So definitely it will offer you great amount of protection, and also you have to be seeing that you have to use the right formulation of sunscreen. So you have to see the SPF, the PA rating. So usually many people are aware that they have to use a sunscreen. It has to have an SPF, or it has to have an SPF, but there is also something known as a PA rating. So usually the UVB rays, they tend to burn our skin, and the UVA rays tend to cause pigmentation and tanning. So we are more concerned about pigmentation and tanning in terms of an aesthetic issue. What somebody with less melanin is concerned about is skin cancer. So that can damage the skin DNA, and skin cancer could occur. For that, if you would see, there's a lot of awareness about sunscreens in like the Western countries, because they are more concerned about skin cancer as compared to the aesthetic issues. So the SPF holds great amount of value in that, but in our case, we kind of want to use sunscreen to, reduce the aging that can occur early on, or the pigmentary issues. So PA rating is something which is very important for us. The other thing is we have to be using adequate amount, like at least 2 finger lengths of sunscreen when you kind of take it out from the tube and apply it on the face and neck. And the other thing is, if the exposure is a lot, then you have to keep reapplying it every 2 to 3 hourly.
2 to 3 hourly?
Yeah.
And you said, so people with white skin are more at risk of skin cancer?
Right.
People with brown skin, so people like us, are less at risk of skin cancer, which is a great news.
Yes.
And that's because we have melanin.
Yes.
And they don't have as much melanin.
Yes,
that's
true.
the key difference, right? The other is the fact that you take sunscreen, use it, but use it more than once a day if you're going to be out in the sun, right? So that's another thing which is going to be helping.
Very true.
Now, when you said PFA, I've heard this term. Does it mean the higher the better?
Yeah, so SPF, the PA rating you mean to say?
Yeah.
Or the SPF?
Both.
Okay, so SPF, usually the more popular ones are SPF 30 and SPF 50. So if it is an SPF 30, it tells you how much amount of the sunscreen the sun rays the sunscreen is able to block and for as much time. So usually if it is an SPF 30, it blocks around 96.7%, and if it is an SPF 50, it blocks around 98%. So that's not a major like difference.
Yeah.
It's about 1%, 1.3%. But if you look at it on a long-term scale, the cumulative exposure that one would gain, that 1.3% becomes very significant. So if the exposure is a lot, then definitely SPF 50 would be better. However, there are SPF like 70, 80 and 90 also, and even SPF 100. However, the thing is, the higher SPF like a sunscreen would have, the PA rating would not be as much. So there has to be a balance between the UVB and UVA protection that a sunscreen has to offer. So SPF 50 is usually adequate enough.
Okay. There are so many brands and so many companies which are doing this. I'm assuming everybody is doing a good job and trying to come up with a good product. But are there products which are more recommended? Are there brands which are more recommended because they are following some guidelines, or they've done a lot of research, or which an expert like you would say, use this and you are safe?
That's also actually a great question, because the market is flooded with a lot of sunscreens.
Yeah.
So the one thing I usually see while prescribing a sunscreen is, of course, it should have the correct filters, it should have the correct ratings, and also like what is the texture of the sunscreen, is it going to be comedogenic, it is going to block the pores or not, how is it for a certain skin type. So usually most of the cosmetic sunscreens or over the counter sunscreens don't mention the percentage of ingredient. So that is something we cannot really vouch for, like how much amount is there and how much protection one would be getting. So most of the pharmaceutical ones which we usually prescribe, they have it mentioned, and otherwise there are studies also that are backing it. So that is one advantage I think one can gain out of the pharmaceutical based sunscreens or the prescription based sunscreens.
So what do you mean by pharmaceutical?
So these are being manufactured by the pharmaceutical companies.
Pharma companies.
Yeah.
Okay.
And these are prescription based. So
But aren't all sunscreens manufactured by pharma companies?
no, there are certain OTC brands which are manufactured by cosmetic companies. There are, of course, like dermatocosmetic companies also that manufacture it. But as a matter, because there are certain natural filters also that are there, and usually they are not adequate enough to protect the skin from sun damage. But the more research filters which are being used by pharmacy based skincare companies, they are more researched, so there is of course more authenticity to it, and also the filters are USFDA approved. So we usually do have a guideline that this amount of filter is better. The other thing is like how is the formulation, are there any comedogenic ingredients, are there any allergens, are there any added components that could irritate the skin. So that is also one factor that we take into account.
So pharma companies will take more care and will put in more research and all that as compared to cosmetic companies. So that's
having said that, I'm not saying that all cosmetic companies do not, but yes, definitely if we would have to choose, and if there was like a benchmark that we had to kind of help somebody understand, then I would probably go with that. Not all pharmaceutical sunscreen might be great, but over the years understanding what the ingredients are and which ones would kind of help protect a person better or will be suitable for the sun exposure that one has during the Indian summers. I mean, that is something that I've come to understand, that yeah, some of the sunscreens are way better than the others.
Right. Okay. Some other terms, you're so knowledgeable that when you speak, you use some terms which laymen like me don't understand, so I'll keep questioning you. So some terms that you used were pigmentation, and of course tanning is of course there, but you also use the word pores. So when tanning happens, again as a layman, growing up as a child, I always felt that the sun is almost burning my skin. So like a roti which gets burnt and becomes dark, my skin becomes dark. Is there more? What does really happen when tanning happens, when that happens? And what is pigmentation and pores? What is the role of all these terms?
So basically, if tanning has happened, then of course there has been some degree of sun damage. So it is not a great thing that the skin has become more pigmented. Right, because
what is pigmented?
Pigmented is like we have a certain skin tone, and when there's increase in melanin in certain areas, then then it manifests in the form of pigmentation. Certain part of the face becomes much more darker as compared to the rest of the face. So there could be dark spots in form of like pigmentary changes. There could be melasma. There could be uneven skin tone. So multiple things that could happen. Pigmentation is basically an umbrella under which dark spots, which are fairly common when people have acne, they occur. And there is melasma, where there's pigmentary changes in the malar area, around the cheek area. Then there could be uneven skin tone. Usually people have forehead pigmentation in case of excess sun exposure when there is tanning.
Now, coming back to what we are doing to cure it and how do we take care of it. So one, of course, is sunscreen. Is sunscreen largely used for the parts of your body where the skin is exposed to the sun, or should it be on the entire body?
So usually exposed areas is where we apply sunscreen, and as I said, if the exposure is quite a lot, as in higher altitude or like on a beach where one is going to be out and the sun is going to be out and about, then of course clothes that are going to protect us from the sun, so UPF rating of clothes are essentially important. But so to say that most of us usually talk about sunscreen application on the face and neck, but it has to be applied on other exposed areas of the body also.
Okay. And is sunscreen different for men and women?
No.
Same.
Yeah, they're same.
Now, what about things that we eat and drink? Do they impact our skin, and especially for the summer? Is there something people should eat? What kind of food impact do we have, or drinking impact do we have on our skin, and how can that be used, especially during the summer?
So there is something known as oral sunscreen. I don't know if you're aware of it. So
No.
usually these are antioxidants that we usually take, and they help protect from sun damage. So basically what sun damage is doing is, it is causing oxidative damage. So we are taking antioxidants that will help prevent or protect our skin from the oxidant damage that could occur because of sun exposure. So diet definitely plays a great role, because it is not just the sun, it is also if you're not exercising, the lifestyle is not good, or like the diet is not good, there's a lot of junk intake, and also stress. All these factors tend to impact our skin, they impact our hair. So having an antioxidant rich diet definitely plays a role. So in terms of that, there is something known as a rainbow diet. So rainbow diet is like you have different colored food and vegetables, so that would kind of give you great amount of antioxidants. Like if you have orange colored vegetables, then beta carotene, like if you have carrots. If you have red colored like tomato, then there's lycopene. So basically green colored vegetables help us get the calcium and the iron. So if you have a rainbow diet, definitely that helps in the skin health, and also helps get us the antioxidants that we need to fight against any kind of oxidant damage, and one of them being sun exposure.
Okay. What about people who are drinking, smoking? Do those things impact?
And definitely they do. As I said, bad lifestyle, smoking definitely makes our skin age much more faster as compared to somebody who's not smoking. Pollution, as a matter of fact, since I live in Delhi, so that also has a great amount of impact
Right.
on our skin health. And like recent studies have shown that no amount of alcohol is good. Earlier we used to hear of having a glass of wine, but now it's been proven that no amount of alcohol is good for the body.
Right.
So definitely.
And same is for smoking.
Yeah.
I'm assuming that's also bad for.
True, that's actually very bad, because like there's of course oxidative damage that occurs because of smoking, and because of polycyclic amines. There could be pigmentation around the lip area, what we call the dark lips, and of course it's a very bad lifestyle issue. And in fact, in my daily practice also, I often see people who are like 25, 26 and who are chain smokers. They tend to have very early onset of fine lines and wrinkles, and they're trying to correct that. So it's sad, but it's true. I mean, it ages us faster. And also, since like the AQI is very high, mostly around the winter time, that also greatly impacts our skin. That also tends to increase the issue of acne over the face, and also like pigmentary changes, early onset of aging on the face. So that's also not a good thing.
Right, right. So, you mentioned aging, and I guess perhaps the biggest impact of aging, or what we define as aging when we look at somebody, if you look at me, look at you, look at somebody else, and if we have to identify their age, it is largely because of their skin,
True.
right? So wrinkles and whatever. So people, I think, are trying to work on it very early now. In their 20s, people want to start taking anti-aging drugs or food or whatever. So what can people do early on or even later for anti-aging efforts to reduce their pace of aging or do anti-aging? What can they do?
So I think even though I'm a dermatologist, I think the number one thing that anybody can do to delay aging is inevitable. Like all of us are going to die one day, we are going to get
Yeah.
old. The only thing is we can do it more gracefully. So I think the number one thing that any one of us can do is having a very good lifestyle, and that is definitely in our hands. When we talk about looking good or having good skin, a lot of it has to do with genetics, and many of us might not be blessed with it, but lifestyle is something that is in our control. So that is something that we should definitely invest on, whether it is good food, healthy food, exercising on a regular basis, and not smoking, bad habits like smoking, drinking, and also, less of stress. Sleep is something which is very important, and it does not take much to invest in that. So have a good sleep hygiene. In terms of skincare, of course, applying sunscreen is one important thing that kind of delays aging, because you are able to preserve the collagen, reduce the damage that can be caused by UV rays or even the visible lights that are out there. The other thing is there is an ingredient known as retinol. So that is essential for the skin repair and boosting collagen. That is also something one can add to their skincare routine. The other thing is there are antioxidant serums like vitamin C, niacinamide that could be added, usually used during the daytime, that could help delay aging and also act as an antioxidant element to our skincare.
You mentioned serums, right? So I spoke to another dermatologist, and the advice I got was, and this is largely going on to hair care now, that shampoos are fine, and then I want to get your opinion on what kind of shampoos. But then after that, after a shampoo, a lot of us use a hair conditioner. But a hair conditioner, what I've learned recently, is meant for hair and not the scalp. Same as the oil. As children, we used to get a chumpy on our head and all that. So what I've learned recently is that oil itself is not really helping you. It's only helping, like the conditioner, to make your hair silky. But the oil or the conditioner on your scalp is actually damaging and not helping. So use a serum. Firstly, do you agree with that? What is your opinion about it?
Yeah, very true. So a lot of people also kind of rub the shampoo on the hair length. So
Okay.
it has to be essentially applied on the scalp, and
Okay.
then when you pour water, it kind of runs down over the hair strands. So that's how it should be applied. But many people, they rub it on the scalp, rub it on the hair to make it lather, because they think the hair is not clean enough. But yes, it does not have to be applied on the strands, and a conditioner has to go on the hair strands. So how like a moisturizer works for the skin, a conditioner works for the hairs, to condition the hair, to seal in the moisture.
Okay, so shampoo on the scalp, conditioner and oil on the hair, right? But the advice was that for men, for example, because we have short hair, right? So where do you put that conditioner on the hair? Because it will go on the scalp.
Right.
So somebody said, don't put it on, don't use conditioner. You use a serum. Do you agree?
Yeah, so
And what is the serum?
So serums also, so there are a lot of conditioners. There are leave-on conditioners, there are rinse-off conditioners. So rinse-off conditioners are the one that we apply. So as you said, like somebody with long hair would apply it on they're more creamy. So serums are more like liquid. So they could definitely go on somebody who has shorter hair, and they are usually stay on.
Okay.
So you just apply them and let them be.
Okay, it's like an oil.
Yeah, so like a rinse off would be you apply it and then you rinse it off. So somebody with the shorter hair would work better with a serum based conditioner for the hair.
Okay, serum based conditioner. Okay, so I will later ask you and maybe note it down, what serum based conditioner should I use. So use serum based conditioners for hair. Now I also heard that there are serums for the skin. right? So tell me more about this. Serum for hair and serum for skin, are they different? Are they same? And what serums should we use for the skin?
So when we talk about hair serums, they could also be serums that would help reduce the hair loss,
Okay.
right? Which go on the scalp.
Okay.
Right, and we talk about serums for the skin, so they are basically lightweight, they absorb better, so and they are meant more for people with oily skin as compared to dry skin. Since they are
Okay.
very lightweight, they don't end up clogging the pores, like since a thicker cream or a thicker formulation could lead to it could lead to comedons and it could lead to acne. A serum is more lightweight. It delivers the active ingredients in a much better way as compared to what a thicker cream might be able to. And certain formulation works better in a serum formulation. Certain ingredients are better absorbed in a serum formulation.
Okay. Okay. The last question, hopefully, is this whole thing about, I think it's called cosmetology or Botox and all these things. Are they good? Are they safe? Um, a lot of people are getting into it. What's your opinion about it?
So most of these cosmetic procedures, they are US FDA approved. Also the machines that we use and also the injectables that we use are US FDA approved. So they have had years of research on them. So they are fairly safe, and also you have to be seeing that who's doing it, what kind of machine it is. So if it is being done by a qualified dermatologist, definitely they would weigh in the risk and they would weigh in the benefit also that are there in these kind of procedures. So they are safe, fairly safe, and it's a very sort of like it's more of a want than a need. Like you would want to do it, it's not that it is needed.
Sure.
So it's of course on the discretion of the person who's getting it. So I'm all in for it, but
Okay.
I'm not saying that it's aging is a problem.
Okay.
It's a choice, like that you would want
It's
to
not
or
a
you not.
must do, but it's a,
Yeah, it's
if you
good
can
to
afford,
do.
it's a good to
Yeah,
do.
yeah.
There's no harm.
Yeah, definitely, because if it is being done by a qualified practitioner, and if the right amount of product is being injected, and if the product that is being used is US FDA approved, then great, no problem.
Okay. What is the cost and what does it do? What do people come for? What does all this do?
So usually people come in for, if you talk about people who are much younger, they would want to work upon delaying it. So usually energy-based devices or light-based devices, which would work on helping boost collagen in the dermal layer of the skin. So something like laser toning, if somebody is a little older, if they've started to have fine lines and wrinkles, then Botox, which would help relax the muscles. And if there's loss of facial volume, then people come in for dermal fillers in order to kind of lift up the face. There are threads that are being used to lift up the face, and then there is something known as HIFU that would also kind of help contour the face, lift it up. So these are depending on what age, what is the concern, what is the aesthetic goal. Usually we tend to kind of recommend things based on that.
So is it that the face of a 20-year-old boy or girl, because of all these things, can almost be maintained till they are 60?
No, not really. See, as I said, aging is inevitable, and also we would not want to make anybody look like way more younger than what they are, because
Right.
that would not be in tune with what their physical structure is. So it has to be very subtle that nobody should know.
But
But
isn't that what society is trying? I mean, I've been reading about a guy called Brian Johnson
yeah.
who came to India and went into this the podcast and got up in the middle of the podcast and said, "Oh my God, AQI, air is so bad." I've been hearing that Mrs. Neeta Ambani does a lot of this, and that's why she looks so young. And Bollywood actresses do it. And aren't they basically trying to look 20, 30 years younger?
They are. So as I said, it's a very personal goal. I would not like to comment on it. As a matter of fact, even I get them done. But there is a limit to which I would, because I would not want to look unnatural. So there's a very thin line. And so to say, most people think that usually celebrities or people who are out there in the public, they tend to get these things done. In fact, the first patient I did was a girl who was based out of a village near Gurgaon, who got fillers done because she had read it somewhere in the magazine. I don't know if it was a digital digital one or so to say a normal magazine. But yeah, she saved up her money. She was making clothes for a living. She saved up the money and got it done. So most of the people I do dermal fillers or Botox in my practice are normal people who are not celebrities, who are not there in the media or anything of that sort. Everybody has aesthetic goals. The other thing is, as a dermatologist or as a practitioner or as somebody who gets it done, I would definitely suggest somebody that, you know, it is always better to look natural than to look unnatural, because you can definitely go overboard, because there can be a desire, like of course Brian Johnson, I have great amount of respect, the kind of investment he does on you know, doing what he's doing. It's incredible, and it's incredible somebody is doing that kind of work. But definitely also it's a thing that you need to keep doing it. So as you said, there are costs involved and everything. So that is what I try and tell patients, okay, this is the thing, this is the goal, and is this what you're looking for, and this is what we could help with. So imparting knowledge, empowering with them with the knowledge, you know, and you know, tuning it with what their goals are, I think is very essential.
Sure, sure. And what is the cost? So let's say I want to get my wrinkles removed. As a layman, and for most of us who've never gone into such a clinic, we have no idea.
Right.
And a lot of people might not go because they might think, "Ke pata nahi, how much is it going to cost? Why should I go?" So what is, if you can give a range of, if somebody wants to get their wrinkles removed, I don't know what I should do on my face, but I want to do something on my face and look younger, what would the cost be?
So first of all, when somebody comes to my practice and they say or ask me, you know, do you think I need Botox or do you think I need filler? I always tell them that, you know, if you think you do, then definitely you do. Okay. I can only suggest what we can do better. So, and the other thing is, we never say remove. Remove is a very strong word. It's always reduction, because you have to you have to make the person understand that, you know, the aesthetic goals cannot be very high. It has to be like, you know, in the normal like means. You cannot totally remove something, and also you have to balance out the aesthetic goals. So if you talk about wrinkles, depends upon how strong they are, how strong the muscles are, and how much units or how many units are needed to kind of relax them. So it can vary anywhere from 4,000 to even like 30,000 in terms of Botox to relax the wrinkles over the face. If we talk about fillers, that also depends upon how much amount of filler is needed. What is fillers? Fillers is basically a hyaluronic acid which is usually present in our skin, and over a period of time it tends to degrade. So we tend to put it we tend to put it over the bone or over to replace the fat that has been lost, the volume that is lost. So usually it depends. So if somebody is around maybe in their 20s, they would need around 1 to 2 ml to look more aesthetically pleasing. If somebody's probably around their 40s, they would need around 4 to 8 ml. If somebody's in their 50s, maybe they would need more. So like a ml would cost around 25,000 to 35,000, and also depends upon what kind of filler it is, what kind of product it is.
And people are doing this in their 20s?
Yeah, there are. So
they must be like young and fit. I mean, why do they need it in
so
20s?
That patient I told you, I think she was 22 or 23. So one problem that we usually face, especially as North Indians, is under eye hollowness, and that we cannot really change, I mean, just by having a good diet or exercising, because there is hollowness, right? There is tear trough deformity. So we have to fill it up. If somebody is concerned about it, definitely one can do it. And the other thing is, even if you talk about FDA, it approves dermal fillers above the age of 18 years.
So when you say under eye hollowness, do you think I have hollowness?
Yeah, you do.
So if I was to remove this?
As I said, yeah, we can definitely reduce it.
Oh, reduce it, sorry. Yeah. If I was to reduce it, how much would it cost and how much time would it take?
So that also depends how much reduction you would want. If it
as much as you can do.
Okay. So if you
assuming I have the money,
right,
then one would want to do the most possible, right?
Not really. So that is where the patient-doctor relationship comes in. So usually I would advise going for less, see how you feel about it, and then we could slowly add up, because that also helps define the aesthetic goal for a patient. Because if somebody has very unnatural expectations, it is very difficult to meet with that. And also if we go step by step, it is much easier. So you don't want to be a changed person. Right. So you see in the media that, you know, people take like blow up pictures of celebrities who've got too much filler done or who are looking unnatural. We don't want to go that path. So it's always better to go slow. Even if you have all the money in the world to invest, it is your face and you have to go on with it. So of course it's better to go slow.
So for a natural recommended as a good doctor who knows me well, what would you say? How much should I do and how much will it cost?
So somewhere around 4 ml would be good enough to start with if there is no restriction of money. And then that would also help you understand, because it's a two-way communication. It's not what I feel.
Sure.
Right?
So 4 ml would be about a lakh.
Yeah, almost a lakh or maybe a little bit more.
Okay. And how much time would it take?
Probably say about an hour.
Oh.
Hour or maybe 2 hours.
So I walk in,
Yeah.
I pay the lakh, 2 lakhs, whatever the cost is. I walk out and I look different.
You look better, not different. You look a better version of yourself, not different.
But better will be different from what I am today.
Yeah, but the point is, see, even if you get 4 ml done, if you meet somebody who you regularly meet at work or like in a social setup, they would not be able to tell that you've got something done. They would just say,
Oh, they would not be able to?
No, no. If they're able to, then that's not a good job.
But I would look better.
Yeah, you definitely.
So they will say, oh, have you
look
done
happy.
something? You look better.
No, they won't say that you've done something. Probably they might say, oh, you look well rested, you look happier, you look less tired, but they might.
So it's not a huge impact.
Yeah.
It is an impact, makes you look better, but it's not like making you look plasticky or
Not really. You can look plastic if you would want to. There are a lot of celebrities who want to look the way they do. There are people who would want like their lips to be really huge. I mean, of course, that's their, aesthetics. Like there are people who like wearing purple lipsticks. There are most people who don't like wearing. So it's a very personal sort of choice, and I cannot impose myself on anybody. So of course, I would like to educate them. I would like to inform them. But then, of course, it is their decision. But even like if you would want to work upon under eye hollowness or probably lift up the face, it can be subtle that nobody knows. But
you look better.
Yeah. Most definitely.
And the other thing that I've heard or maybe even seen sometimes, there is a before and after picture that you see. So there's an actress I used to really like earlier, it's called Meg Ryan. Now, Meg Ryan in the younger days looked really nice. I used to be very fond of Meg Ryan. And with time, if you see her pictures today, she looks really bad. And a lot of people said that she did a lot of these kind of things. And with age, so you've done these things when you were in your 30s and 40s and 50s maybe, but when you're in your 70s, you start looking very odd. Is that true?
That can be true, but you also know where you have to stop. Right? Because there are a lot of patients who've been with me, say, since about 10 years, and I've been doing like fillers for them for a very long time. Sometimes they come to me and they ask me, like, can we do? So, that's where I have to say no. Like, we will have to wait. This is something that we don't want to remove. We don't want it to look unnatural because it is very easy to do. Of course, you can reverse them also, but like a good aesthetic job would be Angelina Jolie. It doesn't look as if she has got something done. So.
But she has?
Yeah, of course.
Oh, okay.
Of course.
I will see her again now on screen.
Yeah.
Okay.
So it has to be very subtle. It has to be very natural. It has to, and also we have to realize. So I also get patients who are 75 years old and they get fillers done. In fact, males too.
Okay.
And so we cannot make them look like somebody who's in their 20s because we cannot be lifting their face as much. Of course, their neck would tell that, of course, their age is not what it looks like on the face. So it's also the body. So we have to make them understand that, there is as much as we can do. And we should not go beyond it. So that's where graceful aging, because we also have to have a degree of acceptance that, okay, this is as much that should be done. So we should know where to stop.
So people, men and women both come to you?
Yeah.
I know that in, again, my generation, maybe even younger generation, there is a lot of consciousness. Men consider it almost to be a taboo that if I go into a dermatologist clinic and say I want to get my skin improved or something done, people will look down upon it, and even the dermatologist might even say, why do you need to get it done? This is mostly for women. So you're saying they don't need to feel worried. They will not be looked down upon if they walk into your clinic or any other dermatologist clinic.
Absolutely.
Same as for younger or older. 75-year-olds or 25-year-olds, both are welcome.
Absolutely.
Right. Okay. The last, I said last earlier, but I'm sorry, I keep coming up with questions. The last is about hair transplant, right? Something which I've been hearing a lot about, and even people have been advising me, including some people from my family, have been saying, oh, you must go to Turkey and get a hair transplant and so things. Do you think, A, it's an okay thing to do? Do you do it, or does your clinic do it? And should people go to Turkey, or should people do it in India? What is your recommendation?
So depends upon the degree of hair loss. I mean, if the hairline has really receded, of course, hair transplant is something that will work. If somebody is trying to work on it early, which a lot of people nowadays are, since the awareness is very high about hair thinning and how the pattern hair loss works. So most of the people are taking medical management in terms of minoxidil and certain oral medications that are there. But if the degree of hair loss is way higher, then of course hair transplant is one thing. And I think most of the people who are doing hair transplant out here, they're very skilled. So it's not that one has to go to Turkey to get it done. And even when we talk in terms of cost, they're pretty reasonable. So I think going to Turkey does not kind of make sense. And most of
But
the
is Turkey much better? Why do people go to Turkey?
I think cost factor could be one thing, and also they are very good at advertising advertising what they do.
Okay.
But I think the dermatologists here are fairly skilled to do a great job.
Okay. And how much does it cost if you want to get hair transplant? The range again?
So it depends upon the number of follicles that are transplanted. So probably anywhere between like 75,000 to even 4 lakhs. It's like on the basis of every case, like how much is the hair loss and how much follicles would be needed.
Sure. Does your clinic do it?
No, I don't do it.
No. Okay. So if you can just for 2 minutes for the viewers talk about what do you do, where is your clinic, how can they reach out to you?
So I practice in South Delhi. So my practice is basically dermatological practice and aesthetic practice, and I also make content on YouTube and Instagram about hair care and skin care. So usually if I talk about aesthetics, then we do laser hair reduction, laser toning, there's HIFU, there's dermal fillers, there's Botox. So in order to kind of reduce the fine lines and wrinkles, we work on pigmentation, treating acne, and of course tanning, melasma, deep chemical peels in order to exfoliate the skin. So basically all that and more.
Okay. And people can reach out to you through your Instagram or through
through Instagram,
website
YouTube, website. Like we are just a phone call away.
Okay. And both genders and all age groups are welcome.
Yeah, absolutely.
You don't look down upon anyone.
No.
Okay. Thank you so much, Dr. Nirupama. It was an absolute pleasure. I'm going to take an appointment and come down and get myself checked and let's see what you recommend.
Sure, definitely.